In this presentation, I'm going to talk about blood transfusion therapy. First of all, whole blood. Whole blood is used to treat patients who need all the components of blood, such as those who have sustained significant blood loss due to trauma or surgery. It can be transfused in its original form. Key uses of whole blood: trauma, surgery. Packed red blood cells. Red blood cells are prepared from whole blood by removing the plasma. Packed red blood cells increase hemoglobin and O2 carrying capacity. Clinical use of packed red blood cells are acute blood loss, severe anemia. Platelets. 1 unit of platelet can rise blood platelet count approximately 5,000 per cube millimeter. It can stop significant bleeding in thrombocytopenia and qualitative platelet defects. Key uses: cancer treatments, organ transplant, surgery. Plasma. Plasma is the liquid portion of blood. Our red and white blood cells and platelets are suspended in plasma as they move throughout our bodies. About 92% of plasma is water. Plasma also contains 7% vital proteins such as albumin, gamma globulin, and antihemophilic factor, and 1% mineral salts, sugars, fats, hormones, and vitamins. Key uses of plasma: burn patients, shock, bleeding disorders. Fresh frozen plasma, or FFP, prothrombin complex concentrate, or PCC. Both contain coagulation factors. Fresh frozen plasma contains all coagulation factors and plasma proteins. Prothrombin complex concentrate generally contains factor 2, 7, 9, 10, as well as protein C and S. Clinical usages of fresh frozen plasma and prothrombin complex concentrate are cirrhosis, immediate anticoagulation reversal. Cryoprecipitate. Cryoprecipitate is a portion of plasma rich in clotting factors. It is rich source of fibrinogen. Contains fibrinogen, factor 8, factor 13, von Willebrand factor, and fibronectin. It uses for coagulation factor deficiencies involving fibrinogen and factor 8. Key uses of cryoprecipitate: hemophilia, von Willebrand disease. Of course, von Willebrand disease is the most common hereditary coagulation abnormality. Blood transfusion risks include infection transmission, of course it is low, transfusion reactions, iron overloads may lead to secondary hemochromatosis, hypocalcemia. Citrate is a calcium chelator. Citrate is the main anticoagulant used in blood product collection and storage. Hyperkalemia, increased potassium. RBCs may lie in old blood units.